D&N Medical Series. This is your girl Nikki, and today I'll be showing you guys how to perform the breast self-examination. So we're looking for lumps that may be cancerous or not. We're looking for masses and any other deformities of the breast. So breast cancer is in both male and female, but it's 99% more commoner in females. So the examination process is a two-step process. So the first one is observing the breast. So you're looking at your breast for the size. So usually one side of your body is larger than the other, but it should not be a significant difference in size. So we're looking at the size, we're looking at the shape. Our symmetry do both breasts look the same? We're looking for any redness. We're looking around the nipples for any discharge. If we try to squeeze our nipple, do we see discharge coming? And we can also try to pronounce the lump by putting our hands at our side. So after observing for any changes, remember, you know your breast best, so you know what to do and know when changes are occurring in your breast. So you put your hands on your hips, just like to accentuate any lumps that are there, and you be like this. You can move from side to side to see if you see any more lumps pronounced. You can also move forward with your hands on your hips, and some lumps that may not be pronounced before will start showing if you do have lumps. The next thing you're going to do is raise your hand upwards. So you might have some lumps that may be fixed to the skin or not, and not pronounced when you move or do the other maneuvers. But when you raise your hand, you can see the lump based on the dimpling or the puckering of the skin anywhere. And we're looking from the breast, we're looking through the armpit area that we call the axilla as well. So the second part of the examination involves you lying down. So you're going to lie down. I can't lie down right now because I have to stand up and demonstrate. So when you lay down, you're going to lay down flat on your back, and then you're going to put one hand like this, because we're trying to accentuate any lumps. All right, so when we do this now, we can palpate or feel up our breast basically. So we use basically we can use three fingers to feel up the breast, and you can go in a circular motion straight back round to the nipple area last, or you can go in a up down fashion, whichever works for you, but I prefer the circular motion. I like to use three fingers because when you use two fingers, you can squeeze the breast tissues, and you might think you feel a lump when it's actually just your breast tissues. So as I said before, we're examining the armpit area, we're examining the breast, and we're going to do that now. So I'm going to start here and go in a circular motion. So I'm feeling my breast, feeling my breast, feeling my breast, coming below, and I go all the way in the armpit area or the axilla, because you can have your lymph nodes here, and breast cancer can spread to the lymph nodes here, and you feel hard lumps or masses here. The lymph nodes are swollen, hard and firm. So you basically feel, and you feel all the way, and you come back to your nipple and you feel the nipple area. You try to express the nipple to see if you're getting any nipple discharge as well, because you should not be having nipple discharge if you're not pregnant or lactating to produce milk. Any other nipple discharge or not normal. So as said before, you know your breasts, and you know if there are changes in your breasts or not. And if you detect any changes, don't be afraid to contact your medical professionals, your doctors, and go get those checked out. And you can do breast examination. You can just do it roughly the same time each month, and yeah, to have a consistent findings basically. And any changes that you pick up, go and get it checked out with your doctor. And remember, it's not just one breast, you're examining both breasts. All right, so remember, two-part procedure: inspect for all the redness, dimpling, changes, discharge, sores, anything. Raise your arms just to pronounce any lumps. Then you lay down, put your hand behind your head like this, then you examine. So if I'm examining this breast, I use this hand. If I'm examining this breast, I put back this hand. so you know you're accentuate any lumps or masses. Alright, yes, because self-examination is known to detect up to 80% of lumps or masses in the breast. Alright, and most of these sometimes tend to be cancerous. And that's it for this video. Don't forget to hit the subscribe button, like, comment, share, and subscribe to help somebody know how to do their self-examination today. And yeah, follow us on Instagram at D&N_Medical Series. Until next time, if you have any question, drop them in the comment section below. And don't forget, like, comment, share, and subscribe. See you soon. Bye.